and DOPR. So it is very important because these leave against medical advice, discharge against medical request, and discharge of patient on the request. So in these types of situations, the blame shifts towards the doctor. Because what happens is when a patient wants to leave against medical advice or they want to discharge against medical advice, so the doctors and the hospital have to discharge them, and they cannot confine the patient, even if it is in the not in the benefit of the patient. So this involves some medical legal challenges. Okay, so what are the various situations, what are the various conditions, and what should a doctor do, and how to safeguard yourself in such cases. So we will be discussing about this. So there is a patient's charter right which was introduced by the Ministry of Health and Family Welfare in 2023, I guess. So it includes the various rights of a patient. So patients have a right to choose a doctor, patient have a right to deny the treatment, patient have a right to choose the alternate doctor, they have a right to leave the hospital whenever they want. So these are all the rights of a patient, and a doctor or a hospital cannot deny them. If they want to leave, then they have to leave them. They cannot, stop them from leaving. So today we will be discussing
Excuse
about
me,
this.
sir. Hello.
Yes.
So just 1 minute, I have an announcement to make.
Okay.
Sorry for disturbing. So we have reached a maximum limit of this session, which is 150 people, and I have still people waiting to join. So if somebody who has joined with the 2 devices, or if some adjustments can be done with the more than 1 people in the department sitting together, so kindly leave the session so that we can permit the others, the rest. Thank you, sir. Kindly continue.
Okay. So I will be teaching about all these medical legal challenges and the precautions which you should take in clinical practice while dealing with patients which are seriously ill, which are children, and which do not want to take further treatment in your hospital or in the settings or in the clinical settings, etc. So what should you do in such cases so that you are safe from the medical negligence cases and the lawsuits in the court? Okay. And the increase in violence against doctor also are due to these reasons, because there is no proper mechanism or the SOP for how to treat this patient, how to give a DAMA or LAMA or DOPR. So I will just start with my first slide. So I will just start with the introduction. Can you everyone see the slide?
Yes, sir. Yes, sir.
Okay. So I start first with the definitions. So definitions of LAMA is leading against medical advice, or left against medical advice, or leave against medical advice. Then the definition of DAMA is discharge against medical advice. And third is the discharge on patient, discharge of patient on request. I have written wrongly here. So what is the difference between LAMA and DAMA? You have to understand the basic difference between the LAMA and DAMA is in LAMA, the patient leave against the medical advice, and in DAMA, patient requests the doctor to discharge them against the medical advice. So in LAMA, the patient will just leave. They will not be given any discharge summary or nothing like that, or no documents. But in discharge against medical advice, they will be given a discharge summary with the legal documentation and everything they have been gone through in the DAMA, because it is the doctor who is discharging the patient, but he is doing against the medical advice. So you have to provide all the details, and the important thing is he have to take the informed refusal. I will come back. I will go back to this in the next slides. And another is discharge of patient on request. Okay, so it is on the due to when there is a patient want a request, and it should be discharged on the request of the patient. So these are all the similar terms, almost similar terms. Okay, so when it is necessary, these LAMA, DAMA, or DOPR, DPOR, discharge of patient on request, when it is necessary. So these are common in emergency, surgical, pediatric, or psychiatric settings, where the patient, there is no one with the patient, or the patient is the sole breadwinner, or he doesn't want expensive surgery, or some there is carcinoma or another things like that, or any pediatric issue where there is no proper treatment, or they want to go to the another hospital or to another city, and in psychiatric settings. So in such cases, this issue of LAMA and DAMA arises. and it carries legal, ethical, and clinical implications. These all are important terms: legal term, ethical term, and clinical term. Legally, what are the legal implications of these LAMA DAMA? Because sometimes what might happen, you are the patient leave against medical advice, and then they comes with dead. Yeah, the patient comes with more severe problems, or they comes after dead, being dead. So what happens is they will blame you. The relatives and the other people, they will blame you कि you have not treated properly, and how can you leave that patient? How can you allow that patient to leave if he was not okay? So there is some legal issues regarding that they can sue you for medical negligence, for compensation. And another ethical issues is like you are as a doctor and you know that this patient, if he leaves, okay, if he leaves the hospital against medical advice, he is going to die. So should you allow it or would you allow it? Because it has ethical implications also. Is it ethically correct to allow a patient to leave against medical advice or to give a discharge against medical advice or not? And what are the clinical implications? Clinical implications are those where the patient gets severely injured after leaving from the hospital, or gets severely diseased. You know, like he was okay, then he thinks that he's okay, and he wants the discharge against medical advice, and he also thinks that the doctor is just keeping in the hospital to increase the bill. So he just wants to leave. But after leaving, we as a doctor, you know that a patient with head injury, we have to observe him for 24 hours. So if you if you don't observe, there might be a EDH or SDH bleed. The patient does not stay in the hospital for observation, but the patient wants a discharge against medical advice. They went, and after that he gets a stroke. So these are all the clinical implications also. So these are the various clinical, legal, and ethical implications of LAMA, DAMA, and other things. Okay. So there are other similar terms. You can see the slide.
Yes, sir. It's visible.
Okay. I'm just asking every time, so there is no issue. Another similar terms or another similar conditions which might happen is discharge requested against medical advice. This is almost same. Then another is overstaying against medical advice. It happens when a patient wants extra leave, or they have some court cases or something where they don't want to go, but they want to stay in the hospital. Sometimes that might happen because of the this reason. So that is called as overstaying against medical advice. And another is admitted against medical advice through administration pressure. Sometimes what happens is in many hospitals, the patient is okay, he can be treated on a regular OPD basis, but due to some administration pressure or other things, they are admitted in the hospital against medical advice. So these are all other similar terms, and they also have legal, ethical, and clinical implications. Okay. So now, what are the legal responsibility of a doctor in such cases? Okay. What are the legal responsibility of a doctor in such cases? First is the doctors have a duty of care if a patient wants to leave. Okay. The most important thing is whenever a patient comes and you are treating him and he wants to leave, it is not like that if you want to leave, okay, now my hands are up and I won't be treating you anymore. It is not like that. Even the patient wants to leave, doctor has a duty of care. So he have to make a discharge summary. He have to counsel him that if you leave, it will be deteriorating for you. It will be against medical advice, and he should counsel that you should not leave. But even if a patient wants to leave, then doctor should give the due care that should be given to a patient. He should tell him what you should not do. If symptoms deteriorate, then you should visit a doctor, and like that. So there should be proper discharge summary, and it should be referred, and also an informed refusal should be taken. So these are all the legal responsibility of a doctor. Another, the consent. It must be informed, voluntary, and documented. Or in this case, the refusal. Informed refusal should be taken, and it should be voluntary and documented. Then you have to take an informed refusal if the patient wants a discharge against medical advice. Okay. So informed refusal contains the consequences of leaving against medical advice. Another alternative therapy. What are the prognosis of the disease? What is the prognosis of the disease? And it should be documented. It should be in the written format. Okay. And failure to document properly, it may lead to legal liability, because the patient may, मुकर जाएंगे कि we did not tell the doctor to make leave us. The doctor was telling to leave us, and that's why it happened. So it should be documented properly, the legal document. Okay. You can see the slide.
Yes, sir.
I changed the slide. Okay. Okay. So reasons patient opt for LAMA, DAMA, and discharge of patient on request. So what are the reasons and why the patients opt for LAMA, DAMA, and discharge? First is the uh, financial insecurity, financial constraints, then dissatisfaction with care. Many times a patient may not have enough money to stay in the hospital, or they may be losing financially because they have to go on their job and earn money. Most patients are from low socioeconomic backgrounds. So that's why they opt for this LAMA, DAMA. Okay. Another is dissatisfaction with care. They might not be satisfied with the care provided in the hospital and they want to go to other hospitals. That's why they can opt for LAMA or DAMA. Okay. Another reason is cultural or family pressure. In many old age patients, like in many communities, including Jain community, where the patient wants discharge against medical advice or leave against medical advice because they think suffering is a form of, culture, ki if a person is suffering in this life, they might not suffer in the next life. So they opt for LAMA and DAMA. I have seen many cases where Jain community doesn't want any, injection or anything done to the elderly patients. Another is seeking alternative therapies. They might want alternate therapy because they might not be satisfied with this current therapy. They might want alternate therapy. That's why they opt for LAMA, DAMA. And this can be the other reason for opting for LAMA, DAMA. Okay. And another is false sense of recovery. What does it mean? It means that the patient thinks that he has recovered. And he believes that the hospital is keeping them in the hospital to increase the bill. And that's why, and they have recovered fully and they want to leave. So these are the various reasons a patient opt for LAMA or DAMA. Okay. First is the financial constraints, then dissatisfaction with care, then cultural or family pressure, then they might seek alternate therapies, and there might be false sense of recovery in the patients. Now, what are the medical legal risks associated with discharge against medical advice and leave against medical advice? The first is there might be a risk of future litigation if the patient deteriorates or die. As I already told you, that if there is LAMA or DAMA and the patient leave against medical advice, but their relatives might come to the hospital and they might file a medical negligence case against you, that how could you allow this patient to leave, or how could you discharge this patient? So there might be future litigation if the patient condition deteriorates or the patient dies. Okay. Then there might be allegation of medical negligence. They might allege that you are medically negligent in providing the care, care that you have given.
Sir, sorry to interrupt, but slides are not changing, sir, now. No?
Okay. Is it changed now?
Medical legal risks, sir, now.
Yes.
Oh.
Yes. So another is allegation of medical negligence can be there. Then there can be breach of duty. They might tell you that they might claim that there is a breach of duty by the doctor. So they might file a case in the NCDRC or State Commission, Disputes Redressal Commission to gain compensation in such cases. Okay. And another is damage to professional reputation. They might record videos. They might defame you on the social media that you did not provide the proper care to the patient and the patient died because of this improper care. So there might be damage to professional reputation. So these are all the medical legal risks if you do not, in cases of LAMA, DAMA. So there might be a risk of future allegation. There might be allegation of medical negligence. There might be breach of duty claims, and there might be damage to professional reputation in such cases. Okay. So what are the precautions that you should take as a doctor while dealing with cases of DAMA and LAMA? Okay. So the most important thing is you should counsel the patient first. The proper counseling to the patient, their relatives should be done. Okay. And if possible, record it for your safeguarding. Now, because this is a time of social media, and digital evidence carries more weightage than the written information. So as much as possible, make digital evidence as your weapon. Okay. So inform the patient about the risk of living, consequences on his health, and how it might deteriorate, and there might be some alternative options which you can tell them. Like if they are facing financial risk or financial constraints, then you can tell them to go to the government hospital. If they want alternative therapy, then you can tell them to, you can guide them to the alternative therapy people. And if they are, another risk, like if they have any problems or like that, then you can give them alternate options. Okay. And another thing is you should ensure that there is proper documentation, and the most important is the signature of witness is there. Okay. Another witness can be anyone. It can be nurse, it can be third party person, or it can be the relative of that patient. Okay. And you should assess the patient's mental capacity, and it should be recorded, because if the patient is not mentally sane, then he might make decisions which he cannot understand. So these things you have to ensure. So the most important precaution you have to take is you have to first inform the patient about the risk of leaving, consequences on health, and the alternative options, if any, present. And you should ensure that the document is thorough, witness signature is obtained, and you should assess the patient's mental capacity. And recently and the most important, you should record all this. If it is possible, if you have to record it, then you should record it, and it will be the best thing as an evidence if there is a future litigation. Okay. Now you can see the other slide. Okay. So what are the other precautions that you should take? First is you should stay calm. You should avoid confrontation. In such cases, you should not be hyper, or you should not talk bad language, or you should not be, blame the patient. You should stay calm and you should avoid confrontation. Another thing is involve senior doctor if needed. Involve the management, involve senior doctor, involve other doctors if needed. Okay. Don't take it alone. Don't do it alone, because sometimes they might help you. And try to explain the risk multiple times. You have to approach the patient in various other ways, not a single way. You have to explain them the risk about multiple times, that you should not do this. This is not good for you. This is like that. You have to explain them. Okay. And you should encourage staying, but you should not force them to stay. So these are the other precautions that you should take. These are all parts of communication. And if you do not communicate properly, it leads to miscommunication, and then this type of condition deteriorates, and this leads to violence and litigation and cases of medical negligence against the doctors. So stay calm, avoid confrontation, involve senior doctor if needed, try to explain risk multiple times, and encourage staying, but don't force them. And use interpreter if there is a language barrier. Okay. Now, what are the key elements in documentation? What are the key elements in documentation? First, you have to fully explain the risk in the layman's language. It is not like that you are in the medical term, so you are explaining them in the medical term and they are not understanding anything. You should try to simplify the risk. Okay. You should try to simplify the risk in the layman language. What has actually happened and what is actually happening and what will actually going to happen if the patient continues to leave against the medical advice. Okay. Now, there should be separate time and date of discussion. It should be mentioned in the document at which time, on which date you started the documentation and you started the discussion. And if you record these things, then it will be mentioned in the camera itself or in that digital copy of the video. Okay. Now, there should be signature of the patient, signature of the doctor, and also signature of a witness who was present there and in whose presence it was done. Okay. And another thing is record of refusal to stay or advice given. It should also be duly recorded. Informed refusal should be taken if there is a refusal. Okay. So these are the key elements in the documentation that you should have. First is the full explanation of the risk, then time and date of discussion, then signature of the patient, doctor, and a witness, and the record of the refusal, which should be stay or the advice given. Okay. These are the key elements in the documentation. So what are the special cases where you should take extra precautions? Cases where the minors are involved. In cases of minors, the guardian consent is mandatory. If the children is less than 18 years of age, if a child who is less than 18 years of age, then the consent of the guardian should be taken. You need not take the consent of the guardian, consent of the minor. Okay. In cases of psychiatric patient, the consent of the guardian should be taken, and fitness for the discharge, it must be certified by a doctor, by a psychiatric doctor. Okay. And in unconscious or intoxicated patients, it should not be allowed. No DAMA or LAMA should be allowed without legal guardian. Okay. So even the patient is unconscious and intoxicated, and the relatives are saying that we want LAMA or DAMA, you should verify if it is the close relative or not. If not, then you should not give LAMA or DAMA. Okay. He should be the legal guardian. Okay. Maybe father or child or mother or something like that. Okay. So these are the special cases where you have to take the extra precautions. In minors, the guardian consent should be mandatory. In case of psychiatric patient, fitness for discharge should be certified. And in unconscious and intoxicated patients, no LAMA or DAMA should be allowed without legal guardian, without their consent. Okay. Now, what are the various ethical dilemma while you face, while issuing the LAMA or DAMA? That the most important ethical dilemma is that the doctor knows that this discharge is dangerous, but the patient is insisting. Then what is the ethical dilemma that a doctor goes through? So should a doctor call the police? Should a doctor detain the patient? Or should a doctor let go with the documentation? So this question is for the audience actually, but this is not an interactive webinar. So in the end of the webinar, I will ask again the same question. So just remember this question, ethical dilemma, what should a doctor do in such cases? Like a patient has committed, consumed a poison and he wants a LAMA or DAMA. Then what should be done in such cases? If a patient is a psychiatric patient and he is injuring others, and you know that patient is not mentally sane and he is requesting for LAMA or DAMA, then what should you do in such cases? And a patient is normal, he is old, he wants to die alone, and he is requesting for LAMA or DAMA. What should be done in such cases? So these are all the questions that I might ask further. So these are the ethical dilemma that a doctor goes through. What should be done in such cases? Whether they should call the police, whether they should detain the patient, or whether they should let go with the documentation. Okay. So now my final slide. This is about the summary. Okay. So what are the LAMA, DAMA, and DOPR? These are the high risk discharges. Okay. Why do you call it high risk discharges? Because in normal discharges, the patient leave after getting complete treatment with proper satisfaction. Okay. And they leave after the doctors are advised them to leave. But in LAMA or DAMA, they are high risk discharges because the doctors are advising against the leave, but still the patient wants to leave. And that's why they are high risk discharges, because the condition of the patient might deteriorate further. And they might sue you for medical negligence. They might sue a litigation against you. They might sue against the breach of duty against you. Okay. So that's why they are termed as high risk discharges. And while signing these discharges, you should take the proper documentation. Documentation should be proper. You should record the informed refusal. You should take it in the writing, and you should take the signature of the witness. You should sign it, write the date and time at which time the DAMA or LAMA was made, and write all the discharge that you have begun, and give the proper documentation. If possible, give a photocopy of all the details that you have given, all the treatment that you have given to the patient. Okay, so they might, if they go to another hospital, they might have all the details with them, and the other doctor might treat them immediately without asking the history. Okay. Another thing is informed refusal. It must be taken. It must be in the written format, and it must be signed by the witness and everything. Okay. You should record everything, and you should always act in the best interest of the patient. Okay. If the patient tells he wants to leave, then it's his choice. He has to. If he wants to leave, you cannot detain him. You can just counsel him. You can just counsel him that if you leave, there will be the consequences, and this will not be good. But you should always act in the best interest of the patient. Okay. So, and when in doubt, always involve a senior faculty or a legal cell. always involve them, because they might guide you, they might guide the patient, and they might help you cross check all the documents that you have made. Okay, so this was all about my today's topic. I think I finished it in 25-30 minutes, because there was not much about this, but it was what was there I've already gave you. So there might be some cases which you might want to discuss, or you might want to ask questions. You can ask me. Thank you, everyone.
If there is any question, please unmute yourself and ask the question.
If you want me to explain you any slides again, then okay. I hope you got the crux of the things that as a doctor you should follow. What are the medical legal challenges, and how to safeguard yourself in such high risk discharges.
Sir, I have a question that whether anything standard pro forma is available for this LAMA, DAMA and DOPR.
I have searched the internet, but there are no specific format. Each hospital has their specific format. And as I told, if you have everything, like there should be, if you want to make a proforma, you can make a proforma with a upper date and time, then LAMA or DAMA. Then you can make a proforma for the discharge summary, where all the investigations will be written, then signature of the witness, signature of the doctor, signature of the patient. And it should be written in the layman language, so that the patient understand. And you can also make your own proforma, but you have to look for these things, see what you should do. Okay. Yes, Raju, Shafi and Nas have raised their hands. You might want to ask something.
Please unmute yourself. Shafia, Raj.
So let me get back to the previous slide, where I was talking about the ethical dilemma. So what should you do in such cases? These are the three options that you have. What should you do? You can type in the chat also. You should call the police, you should detain the patients, or you should let them go with the documentation. What should you do? You know the patient of discharge is dangerous. He might, like a patient has come with the ECG. Okay. And, and there is, increase in tropa and tropy. And you are thinking that he is suffering from myocardial infarction, but he still wants to leave. He thinks that the doctor are trying to loot him and something like that. So what should you do in such cases? Because I got one question in the chat.
Please write your questions in chat box. If you have any question, we have one question. Wait a second. We have. Thank you. Please write your question in chat box or unmute yourself.
What precautions should be taken when referring emergency patient to higher centers? Okay, this is a referral. You are referring the patient to a higher center because you don't have proper resources to treat the patient in your center. That's why you are referring. So while referring the patient, you should write all the tests that you have done and what are the test results, and in clear indication of referring the patient to the higher center. And if the patient needs oxygen and something like that, then you should convey it to the relatives that the patient need a oxygen cylinder, or the patient need a continuous monitoring. So if a staff should go with them or not. So you should tell the risk of the referral and the nearest center, and you should tell the nearest center where you have been referring. And you should inform the doctor, if possible, where you have referred, that a case of such and such is coming, so be prepared. So that what you can do from a doctor perspective in such cases. And the documentation, you should take the sign of the witness, if patient is unconscious, then the sign of the relatives, consent of the guardian, and then you should do the referral. and mention the why you are referring the in proper words. This is the reason that why we are referring this patient to the higher center. In case of Osama, if doctor supports for patient and patient with an intention, where is this Q&A section? I cannot see. No option. I cannot see the Q&A section.
Please send your question again.
Question is in there, I think in the Q&A section, but I cannot find the Q&A section here. Okay, yes. All questions. What is first? In case of Osama, if doctor supports for patient and patient with an intention to avoid judicial punishment, if proved, doctor can be punished. Yes, doctor can be punished because doctor will be liable for for assisting the patient in illegal activities. So doctor will be punished. Yes, overstaying against medical advice. So you should not encourage this, because you can be punished, because if the doctor wants to avoid judicial punishment and you are falsely overstaying the patient against medical advice in the hospital, then you will be termed as a co-conspirator in such cases. Another question was there, is LAMA be only the casualty slip that the patient takes with him or her? Is LAMA be only on the casualty slip? You can, there should be proper discharge where you should write everything. There should be a pro forma where everything should be written. The informed refusal should always be there, and there should be proper discharge summary like that. Okay. Should not be on the casualty slip, but if you don't have a pro forma, then you should mention it on the casualty slip, because already in the casualty slip, you will be mentioning all the investigations and the details and the history and everything. So there might not be enough space to write on the casualty slip. Any other questions? I hope you understand. You got these medical legal challenges and precautions that you should take as a doctor while dealing with LAMA and DAMA.
I think there is no more questions.
Okay.
Ma'am, shall we can conclude the session?
Yes, Dr. Ashish, please.
Okay, so on behalf of Visharida Parishad Agatantra Sambhasha team, I extend my heartfelt gratitude to everyone who made today's enlightening webinar possible. First and foremost, I express my sincere thanks to our esteemed invited expert, Dr. Dheeraj Maheshwari sir, Assistant Professor, Department of Forensic Medicine, PMCH, Udaipur.